My name is Tim. I'm retired. I'm 78, and I suffer from an illness called CLL, which is a chronic form of leukemia. Chronic means it can't be cured, but it can be under control by continuous treatment. Because of this, I had to have a lot of tests. I have to have monthly blood tests, and I have to have occasional CT scans and ECGs as well. So the tests are to monitor the illness itself and also to monitor the effectiveness of the treatment. And what this means really is that when I have my monthly consultations with the oncologist, before I go in, I see the results of the test. And that sort of empowers me to be able to ask the consultant the right sort of questions, rather than coming from a position of ignorance, really. I look at the results. It's most important for me to see the results before I see the consultant. So I'm looking at the results. I'm looking at the good results and the bad results. I want to see where progress is being made and where perhaps progress is not being made, or where things are getting worse. Once you're logged on to Patients Knows Best, it's dead easy. There's a list at the top that you can click on, which shows things like appointment letters. It shows things like the results of tests. Then it gives you figures, but it also gives you graphs. So you can see the graphs going up and down, and you can read from that there how well you're doing or not, or as the case may be. The value of people being able to see their records is foremost the fact that it is incredibly empowering. A lot of people are frightened by the NHS. They're usually there because there's something wrong. Some of the people that work there use jargon that they don't really understand. And I think the fact that you have access to your own patient record means that you know what you're talking about when you're talking to doctors, and you know what your history is. And of course, the other thing is they say, have you had any illnesses in your life? And you can never remember when you had them and how long ago it was. So it's always helpful to have that on tap. If there was an acute incident and I had to go into a hospital for some reason, like being knocked over or something, I've got those results on my phone. So, for instance, I have a form of leukemia. I can show the doctors there that my bloods, my clotting time, things of that nature, which I think will probably help those doctors to treat me, and also mean that they don't have to do extra tests and I can be treated a lot quicker. I think because for a lot of people, they're disempowered as patients. They become numbers or figures on a spreadsheet, or they feel that. Perhaps that's not the case, but that's what they feel, that they're just one of many people going through a meat grinder in many ways. Patients do know best. You know best about your own body and what's happening to it. So I think it's a jolly good name.